Hi, good evening, Srishti.
Hello Bhavika, how are you?
I'm good. How are you doing?
Very nice. Okay, so I think many of our followers and many people are joining. So
Yeah.
we'll start our today's live. Maybe Bhavika, you can tell us about the topic that we're going to discuss today.
Okay. Today's live about is PCOS. It is one of the major hormonal disorder, like through which many of the females are suffering these days. Like approximate 1 in 5 are suffering from this disease, and it is like a manifestation of a poor lifestyle which we have like we have seen. So we'll see like how integration of homeopathy, movement, and nutrition together helps in treating such kind of hormonal disorders.
Yes. So before we start about the management of PCOS through
Yeah.
homeopathy and integrative approach of nutrition and movement, I'll just briefly talk about PCOS. So it's like Dr. Bhavika said, it's a hormonal disorder of reproductive age basically, where there is imbalance in hormones and the clinical signs and symptom basically consists of irregular periods, and then there is excess of androgen which can cause in some patients weight gain or obesity, or it can also cause like there are cyst forms in ovary and acne is there. So these are the common signs and symptoms that people suffer from, and complications can also lead to insulin resistance in many patients, and then there is increase in bp there. Insulin resistance can again cause obesity, which will cause fat deposition, which will again lead to increased secretion of androgen. It forms a vicious cycle of these events. There is also many pigmentation issues related to the skin and acne that occurs in many patients. So these are the common signs and symptoms. And so basically the complications of PCOS will consist like, first of all, we see that there is infertility that is mainly coming up. And then there's again also complication of developing type 2 diabetes. And if the patient might get pregnant, there is increased chance of getting complicated pregnancies. There can be few complications related to obesity like sleep apnea. There is increased in cholesterol. So these are the commonest complications, and diagnosis can be done by on a clinical basis, or it can be through ultrasound where the cysts are seen in the ovaries, and other blood tests which will measure your hormones. So this is the basic idea of the disease that is very prevalent today, one of the commonest lifestyle and hormonal disease that is encountering. So we'll now talk to about its management. As we know in modern medicine, the management generally given is the regulation of periods through OC pills, or managing the complications, or if someone is having infertility, so they will try to have some IVF or other methods through which they can try. But in homeopathy, we will see how we can manage with the integrated approach of nutrition and lifestyle changes and exercise. So, to discuss our homeopathic approach, we are going to have a very special guest joining with us. And till then, maybe Dr. Bhavika, you can slightly give a brief about the nutrition that we are going to be covering today in today's live.
Yeah. So see, like as I said before, the disease is majorly the cause we don't know directly, but it is the studies are showing that the PCOS is majorly caused because of a poor lifestyle. So a lot of sedentary habits and poor diet and eating a lot of junk food and etc. So management, if we see like as I told that integration of everything helps. So mainly talking about the nutrition and diet part. In regarding to PCOS, we ask the patient first of all to avoid allopathic medications like oral contraceptive pills or taking metformin because it doesn't helps much. And the other thing, the main thing in diet which we advise them is to avoid sugar, sweets, sugary products in any form. Instead, we tell them to they can take jaggery or honey or date syrup, and but that too from an authentic sources from where they can get. And also we advise them to take to avoid milk and milk products, or we tell them, instead, if they want to take that, we tell them to take a low fat milk. And mainly we ask patients with PCOS to avoid taking packaged food or junk food, frozen food, and also they we tell them to avoid using a microwave, and also to avoid using plastic, utensils or bottles, because they are not good. Instead, they can use bottles which are made up of stainless steel or glass. And also related to the nutrition part, the diet should include a lot of fibers, lot of protein, and a low carbohydrate intake. That is, they don't have to completely avoid the carbohydrate, but they have to take products which have a less GI, that is the glycemic index value, the products which are having. So we usually ask patients to avoid white rice. Instead, they can take a brown rice or a low quantity of a white rice if they want, and completely avoid the refined flour, that is the white flour, the things which are made from that are mainly the bakery items, cakes, pastries, cookies. We ask them to completely avoid them. And in the morning, we usually ask the patients to take kind of a drink, which includes a warm water and a little cinnamon or a lemon or a ginger, or including all of that, which are rich in oxidants. And even with all this, sometimes we also add some kind of seeds in their salads, or in a raw form, like flax seeds, or sometimes fenugreek seeds or fennel seeds, or different kind of seeds which helps them. And these are like the main thing in PCOS is that you have to, like, you don't have to be sad that you are having a PCOS, and you don't have to be like, I cannot get better with this. But we have seen many cases which are getting reversed. And the main thing is that you have to take a charge for yourself, that yes, I can fight this disease, and I can get better with the help of homeopathy, nutrition, as well as with the proper form of exercise. And one of the main thing which we have also, the patients have to take a frequent meals, because in PCOS we cannot advise a lot of fasting, because there is a lot of fluctuations of the insulin levels in the blood in PCOS which we have seen. So you should avoid like a lot of fasting. You should, and for reducing the weight, you should not eat less, because that is not good, and that is not advisable for PCOS cases. So that is the thing. And even after, like, they have to complete their dinner early, that approximate around 7 or 8 at night. And after that, they should go for a walk, because what we have seen is there is a study that there is some relevance of moonlight and the hormonal cycle of a female. So that is also advisable, that they should go for at least for a 15 minutes walk at night after their dinner. That also helps them. So these are the certain, like, mainly these are the changes. And sometimes we advise supplementations also, but that too rarely, because they are having a lot of deficiencies of vitamin D, as well as deficiencies of iron. So we advise supplementation, but that is a later stages, if they are not responding well to the nutrition plan. So after that, we tell them. And at night also, we advise them to take a kind of a detox drink with warm water. So these all things together in a nutrition helps them a lot. So this is about the nutrition part. And for regarding the exercise as well as the homeopathy part, I will again call Dr. Srishti to talk about the exercise part. And for regarding the homeopathy talk, we'll first invite Dr. Gaurang sir to talk about it. Good evening, sir.
Good evening. How are you, Bhavika?
I'm good, sir. How are you doing?
I'm very good. So, I think we have a lot of people who have joined here gradually, and I think it's a good idea to talk about polycystic ovarian disease and homeopathy. And in the last 5 years at least, there haven't been too many days where we haven't treated cases of PCOD, and this has become so common in today's times. You and Dr. Srishti already spoke about how how you guys are doing so much of work where you are guiding the patients towards healthy nutrition and certain movement changes for them in PCOD. But I just want to talk to you about the homeopathic approach here. And Dr. Bhavika has worked with us before. So she sees and she knows the kind of cases we treat with. So polycystic ovarian disease, just like any other case in homeopathy, will require individualization, just like in any other case. It's not too much different. And I'm just trying to remember one of the first cases of polycystic ovarian disease I saw, I don't know, many years back. And this was a young girl, about 20-year-old, and her main sensitivity was that she was not getting periods, but her main sensitivity was, she said, I don't care about the periods, doctor. My problem is that I'm putting on weight and I'm getting a lot of acne on my face and just just this appearance, for me, I'm very sensitive about appearance, how I look, how people perceive me, what is my image in front of people. This is something that I'm very, very conscious about. Doctor, I've become very conscious about everything. And I studied her entire case, and it was a very, very beautiful case of the remedy silica that came up when we studied the case in detail. And silica really, long term, put her in the right hormonal frame, and her polycystic ovarian disease gradually improved. So these type of cases, again, individualization will be the keynote in most of these cases. I'm just trying to remember with so many different cases. If I can give a few more examples, I remember another case of a young girl, again another young girl. That's why the age group, you see, almost 50 to 60% of ladies between the age group of 18 to 34 would have PCOD in cosmopolitan cities. One of the reason is because of our lifestyle, what we eat, what we drink, the fat diets that we are into, the no exercise routine that we are into. And one more very important fact that, Bhavika, you should also tell our patients about is the sleep patterns. Because I believe most of the hormonal problems have to do with stress, lifestyle, and importantly sleep, which means that you have to choose one time in the sleep, your sleep pattern. Let's say you sleep at 10 o'clock, you get up at 7 o'clock. You have to make sure that you have like a circadian rhythm there, where for 8 hours, one flat time, you sleep at that particular time properly. That really helps to improve the hormonal system. So someday you'll get up, very, very late. Someday you'll get up very, very early. That's not very good for the hormones. So I think that's a very important aspect that we suggest our patients in the PCOS or any kind of hormonal problem, typically more in PCOS. Yeah. So I was telling about this kind of cases that we are seeing with PCOD. And now, because of last few years, we are using a lot of sarcodes, remedies like uforinum, remedies like folliculinum in clinical practice. That has really changed the everything, the whole clinical practice. Because previously, the hirsutism, later on with PCOD, there is infertility. But with the help of the right homeopathic remedy, there is a possibility even PCOS cases who are coming with infertility without any external IUI treatment or anything like that, with homeopathy, with nutrition changes, with lifestyle changes, we can make a difference. And that is what makes this really special. Homeopathy, lifestyle change, and integrated homeopathic treatment, of which Bhavika and Dr. Srishti are mainly part of. What I would really like Bhavika and Srishti, both of you, to talk about is your experiences with the cases that we are treating here with homeopathy, and what are the changes you tell them, what are the changes you tell the patients with relation to their nutrition plan, with relation to their sleep patterns, with relation to the exercise routine that works with our exercise team in our center. So it would be great to know from you what are the experiences, what are some positive feedbacks, what are some beautiful testimonials. Just maybe a few months back, we treated a very complicated case of very bad ovarian cysts that were totally reversed on the sonography with help of homeopathy. Maybe we'll present that case at some point. So I think that this is why we have started this center of holistic integrative kind of treatment, where along with homeopathy, we are trying to work at the lifestyle change, nutrition change, and exercise routine. some thoughts, some questions from you, Bhavika, or some questions from our participants. That would be really good, and some thoughts there.
So we are not having, but I would like to ask you a question related to this. Yeah.
So go ahead.
So usually, uh, what difficulties you face treating such kind of diseases? Like, what are
The
the
main,
difficulties
the,
in
I'll
hormonal
tell you the
treatment?
main difficulty that I face, and I would not say I face, all homeopaths face,
Right.
is to explain the patient that in a case of PCOD and in a case of endometriosis, or in a case of hormonal disorders in ladies, or any case of ovarian cysts, but typically in PCOD, after starting the homeopathic remedy, things are not going to change overnight. You're not going to get periods suddenly. So if someone is having amenorrhea or no menses at all for some months, just by giving one remedy, don't imagine that in 15 days everything is going to get cured. Hormonal disorders require time. So I think the main challenge that comes up is in kind of educating the patient and the family, the girl and the family, about the timeline, that it's a long term treatment. We are trying to really reverse your hormones. We are really trying to dehormonalize your hormones. We are really trying to set up in such a way that your hormones are, which are totally asymmetric, they are in the right line, which generally, what in my practice, it's anywhere between 6 months to 1.5 years. So many of these patients, they don't understand that just by taking an allopathic hormonal pill and you're getting an artificial menses is actually not menses. It's just an artificial bleeding that you may feel is actually you're getting your menses. So it's much better for them to wait with homeopathic treatment, with lifestyle change, with diet change, wait gradually so that we can really work at the root cause. Why homeopathy is so beautiful? I was just telling one of the patient a few minutes back that in the clinic, that why homeopathy is so special, because it causes a kind of change at a deeper level and long lasting one. It is not just a short acting one, 15 days and you get it again. No. When homeopathy works, it will work at a deeper level. The system will change, the immune system will change, the hormone system will change. It acts at a PNEI axis, that is the psycho, neuro, endocrino, immunological axis. And when it happens, when the remedy exactly acts, things change. Something within changes. Your core changes. Your state really, really changes. That's the idea that I want to give the patient's family, to homeopaths, to everyone, because educating the patient and the family is the biggest challenge for us in our hectic timeline of practice. So I think that's the main kind of challenge. I think there is a question by Akshu. You were conducting a practical course 6 months. Now you are calling advanced course. Are the course same? Hello, Akshu. I hope you're doing well. No, they are different. The course we conducted last year was different. The topics were different. The teachers were different. The lectures, my content was different. And what I'm teaching now is absolutely different. If you're not part of it, you're welcome. You can just write down my email ID. Maybe Dr. Bhavika will put up my email ID. You can just write an email and join us this Friday. I'm teaching.